Okay, so I'm going to be demonstrating my manual therapy techniques week 2 and week 8. I'm going to try to do together. We were kind of talking with Professor Hogan about this and what kind of manual therapy techniques would be a good idea week 2. Um, we kind of talked about the possibility of doing grade 1 oscillations for pain inhibition, just doing that to the humeral ulnar joint. Um, and we're just kind of concerned about probably the risk behind that with all the fractures that are there with the coronoid process and the radial head fixation. Is that a good idea? We don't really know. So I'm going to probably go with the safer intervention here and just do some soft tissue massage or mobilization to more of the surrounding muscles at the biceps and triceps and just kind of around at the brachioradialis. Just muscles that are kind of attaching in around that area. And since we're immobilized for a few days, and just also after the immobilization period, we're only allowed 15 degrees of flexion, basically, is the most extension we can get, and up to 105 degrees of flexion. So tissues are going to probably end up, there could be adhesions and contractures developing with that. So essentially, what we're gonna do is I'll just have Michael on the table here, his arm resting on the table. Brace is gonna be off, and I would apply some free up just to kind of, make sure we're not having too much friction with the massage. And so essentially, I'm just gonna start with effleurage, just kind of doing more superficial, try to stimulate blood flow to the tissues. I'm gonna get behind the triceps too, but try to avoid the scar that's in the back from the approach of the surgery. And then once we have developed some blood flow superficially with this effleurage, we're going to start getting a little bit deeper with these adhesions. So I'm just going to kind of run parallel with the muscle fibers. So again, just trying to work on maybe breaking up those adhesions that might be developing from the contractures. I'm going to work the triceps too, just with my fingers in the back, just running up and down, and then eventually go to the forearm. So I'm just kind of on the brachioradialis mainly, just muscles that'll be running by there attaching, maybe some work on the common extensor muscles too. So it's just essentially that's just what I'm going to try to do week 2. For week 8, I think eventually by week 8 you can start doing some more of those grade 2 to 4 immobilizations of the elbow. I don't know if it's quite grade 4, but I just make sure that the protocol allows for it. But eventually, when that's the case, we can work on doing that. So I might have Michael put his hand on his bicep here just to kind of anchor it. And that actually, I might actually not have you do that. That's not going to work. But essentially, I just want to grab the ulna here, try to avoid the radius and try to avoid that scar in the back. And maybe it's healed by now, but essentially, I'm just going to take that ulna and try to posteriorly glide it. It's a concave on convex kind of joint. So I think extension of the arm is going to be probably the most limited at that stage. So we're going to do posterior glides to try to help increase extension range of motion. And so that will be my technique for